So I'm currently an ST6 training in the southwest. So I did my F1 and F2 in Swindon. I went straight through to core surgical training in Severn, through which I rotated in breast urology, vascular, obviously, and upper and lower GI surgery. Then went into my ST3 vascular year in Bristol, in Southmead, ST4 general surgery in Taunton, ST5 vascular in Exeter, and I've just started my ST6 and come back to Bristol. Actually, vascular surgery was one of the only surgical specialties I had convinced myself I knew I didn't want to do. The reason for that was I think I didn't get enough exposure to it when I was a medical student, and so I'd written it off. I thought I didn't really have very much knowledge about it, and the only thing I knew was the vascular ward smelt and there were smelly feet everywhere, and I was sure I didn't want to be involved in that sort of thing. And it wasn't until actually I did my vascular job in CT1 in Taunton that I realised actually I love vascular. I love our patient group. I think they're a complex patient group that involves complex decision making. So anybody that's got vascular disease smokes, so they've got lung disease, they've got cardiovascular issues, they often renal patients, and they're very complex medical patients to manage. So I really enjoy the puzzle of not just what can I physically do anatomically to fix this patient's issue, but how can I add that into all of the other things that's going on with this patient? Is this the right operation for them? Is it right to put this frail elderly gentleman through a 6-hour bypass procedure? Or should we do something suboptimal to get him out of trouble, but that won't have the side effect of killing him? My favourite vascular operation is a carotid endarterectomy. The reason I love carotids is I think the anatomy in the neck is just so beautiful. I think it's an operation that can go extremely well, or it can be extremely hairy, and you never quite know what you're going to get. I also love carotid body tumour excisions. I've never done one of those myself, but I've seen a couple, and I'm really intrigued by them and would like to do more. What do I like to do outside of work? So I'm in a band, so I'm in Dusty Moonshine Big Band, which is a 14-piece big band that does brassy jazz numbers with an underlying electronic beat in it. We got a top 20, top 40 UK album chart position last year in COVID, and we're working on some new material which I've been recording and writing recently in sessions. Alongside that, I like to go for a run. I feel like I have to run. I don't enjoy it. And I like to do aerial circus stuff, so I do aerial hoop and trapeze performances. Making a difference to people that have severe chronic pain, that go to sleep with that and then wake up and go, oh, I can feel my foot, it doesn't hurt, I can sleep with my leg up. That's really satisfying. When you do a thromboembolectomy and drag a load of clot out and you see this long worm of gelatinous clot come out of an artery, repair the arteriotomy and then let the clamps go, and you see what was a white foot go pink immediately. That's really satisfying, knowing immediately that you've made a difference. There are a lot of challenges. So vascular surgery doesn't always go well. There are a lot of operations we do that have high mortalities, a lot of operations that have high failure rates, or that people are having their last ditch attempt at anything. There are a lot of difficult conversations with patients and their family. But actually, when these are done well, these can actually be a really satisfying part. Having a conversation about not taking an active path for treatment can actually be very uplifting if done well. How do I manage work-life balance? I go to work when I'm supposed to be at work. If I ever want to be at work when I'm not supposed to be, for example, for specific operations for training, then I will maybe volunteer to go in, but I haven't done that very often. I've done that for some open aneurysms after discussing in advance with consultants. But the majority of the time, if I'm not at work, I won't go into work. And I will fill my time with things that I love. So I will do crafty things, I will do things for the band, I will spend time with my family. Value the time that you have not at work by separating it, and you will enjoy the time that you have in work more. So I think the advice is fairly generic to aspiring anything. A lot of people ask me what about the barriers that we have in vascular training or in surgical training in general. And they ask about work-life balance, they ask about children, they ask about all of the practical things of doing a job, or the number of times you get called out, or what you have to do. Worried that maybe they don't want to sign up for a more hectic specialty, which I'm not sure vascular is. But actually my advice would be to just pick what you want to do and what you enjoy. Because if you're doing what you love, none of it feels like hard work and you don't mind coming in or staying late. I guarantee you, if you're doing a job that you don't enjoy between the hours of 9 to 5, it will feel to you much, much longer than the sensation of time passing for me when I'm in at 2 a.m. doing a bypass.